Real men take care of themselves so that they can take care of those around them too. And they need a health care provider that understands them. That's where Man-Centered comes in. Deciding to start a family is one of the most important moments in any couple's story. Creating new life together reinforces their emotional connection and reaffirms the couple's needs. But not every couple finds it so easy. 15% of couples have difficulty conceiving, and you won't be surprised to hear that in 50% of the cases, the problem is the male who has decreased fertility. Man-Centered is one of the very few male fertility enhancement centers to cater specifically to a man's needs. Before we can treat the problem, we first need to understand what's causing it. Taking a sample of semen allows us to check for low sperm count and problematic abnormalities with size, shape, and swimming ability. Additional tests can check whether abnormalities within the sperm DNA is the cause of the decreased fertility. And a thorough physical examination allows us to identify problems with the testicles, the tubes that transport the sperm, the prostate, the penis, and the urethra. The most common physical problems can be divided into two categories: issues with sperm production and issues with sperm transportation. Production can be affected by lifestyle choices, prescribed medications, genetics, hormonal abnormalities, conditions that result in excessive heat around the testicles. Transportation problems can be caused by previous infections, surgeries, trauma, as well as abnormal development within the duct system. At Man-Centered, we combine medical and surgical treatments to boost sperm production and improve sperm transportation in order to enhance male fertility and increase the chances of natural conception. Couples undergoing fertility treatment can conceive in three basic ways. First, timed sexual intercourse. Second, intrauterine insemination, where washed sperm is placed within the uterus so that it does not have so far to swim. Third, in vitro fertilization, where a woman's eggs are removed from her body and has the sperm injected directly into them. It's important for any conception to be as natural as possible, so the method chosen depends upon the man's sperm count and any other problems with morphology or mobility. The higher the sperm count and the stronger the sperm, the more natural a method can be used. None of these methods have a 100% success rate, but with Man-Centered's help, you'll be fully prepared, and our team will work closely with both your partner's gynecologist and the IVF centers in order to maximize success. Men with a sperm count of 0 require a much more in-depth evaluation. In these cases, the primary goal will be to restore the flow of sperm from the testicles and into the ejaculate. And restoring your ability to procreate isn't the only reason to tackle male fertility problems, as they can be often a symptom of another underlying condition. Our evaluations regularly uncover hormone and prostate problems, circulatory issues, genetic abnormalities, and even testicular cancer. When it comes to healthcare, real men don't just ignore their problems. They get help from the one place they can be sure understands their needs. Man-Centered, better lives start here.